everybody, welcome to the Mancoll Minute. Hope you're having a great week and are going to have an awesome weekend. So lots of interest, some questions to me through social media, but actually in the office itself, this week alone, I had 3 or 4 patients come in wanting to do breast enlargement, but are a little bit leery about using implants. I had 2 patients with implants who want to take them out and use their own tissue. And I think that's great. I do a lot of fat grafting, not just to the buttocks for those folks looking for Brazilian butt lifts, but really to the breast, both cosmetically, but also on my reconstructive side for the breast cancer I take care of. So let me just kind of clarify a few of the points that I think are real important takeaways. Breast implants are awesome. They are safe. They are very popular, still the most popular surgical procedure. They come in all kinds of shapes and sizes to meet your needs and goals and what look you're looking for, and part of my job is to help you sort that out. But fat grafting is not a one-to-one equivalent substitute for breast implants. And what I mean by that is this implant gives you shape, structure, and form, and when placed right, it gives you beautiful projection and all the characteristics we're trying to achieve in an augmented breast. When I'm injecting fat in as a substitute, I'm creating volume in your breast, but it doesn't have the structure that an implant has in the bag. So it doesn't give necessarily the perkiness. Now, if you have super tight skin and you put fat in, yeah, you're gonna have perkier breasts because you've got the skin to do that. But if you're a mom that's had, a kid or 2 or 3 and the breasts are just deflated, they sort of lost that volume, I can fill it up with an implant, but I can't give it the same kind of structure. I can fill it up with fat, but I can't give it the same kind of structure as an implant would. So as much as I like the idea of using your own fat, and it seems like maybe a healthier alternative for those that have concerns about breast implants, it really doesn't have the same characteristics, so it's not going to give you all the same outcomes, especially with some of the pictures I see that people are looking for, with these really kind of perky, youthful, tight-looking breasts, but loose skin to start with. So I think it's a great concept. I believe in it a lot. I do it a lot. I've got the equipment that helps me do it, I think, very effectively, but it's just really not the exact same thing as what an implant does. So again, part of my job in talking with you and getting you ready for surgery and deciding between implants and fat is going to be ultimately, what are your goals for your breast when this is all done? And there just may be, if your goals are heading down a direction of just really kind of a lot of projection, implants still may have to be your choice. And maybe fat we do as a combination, even just to kind of soften the edges, especially if you're really thin. Do we call it composite or a breast augmentation, where you do a little fat, you do a little implant, and you don't have as big an implant maybe because you're using fat as a little more of a substitute. So there's all kinds of kind of potentials there. But come on in, we'll talk about it. We'll sort of kind of see what's right for you. And again, there's a lot more in this conversation than I can certainly get through in this couple of minute video. But let's kind of make sure that your goals are the things that we achieve when it's all said and done, and then what product and or kind of technique is going to get you there. So hopefully that was helpful for you. Have a great weekend, and I'll talk to you soon.